My name is Maureen Okereke. I'm here to present my integrative therapy video. Segment 1. Zara is a 20 years old vibrant African American female who migrated to the United States 3 years ago from Kenya. She lives with her husband and parents-in-law. She has been married for 2 years and was expecting her first child, a baby boy. No history of psychiatric illness. She was mostly active, upbeat, and cheerful during her pregnancy. She gave birth to a healthy 5.3 pound, 3 ounces baby boy. After delivery, she started to feel sad, overwhelmed, and consistently tearful. She frequently felt irritable and on edge. This feeling persisted for the first 10 weeks after the baby was born. She had limited support. Both parents died in a traumatic automobile accident 7 months into her pregnancy. Her in-laws were much older with numerous health complications that could not help. Zara's symptoms continued to worsen. She became more tearful and felt she was a failure as a mother. Her baby cried incessantly and she could barely get any sleep. She also helps in taking care of her parents-in-law who are both incontinent and need help with ADLs. She struggled with getting the baby to latch during nursing and didn't want to give him formula. Zara felt utterly incapable of soothing her baby. She felt that she was in constant race against the clock with nursing, pumping, and changing, always cleaning Barrow's diapers and helping her parents-in-law. She felt horrified with the way she looked. She hadn't gotten her hair or nails done or could not even think of intimacy with her husband. Her husband works 12-hour shifts 6 days a week in a construction business to support her and his parents financially. He tried to be supportive when his home birth felt at loss and overwhelmed by Zara's worsening health condition. Zara's husband took 1 week time off from work to help out at home. He made an appointment with her PCP to evaluate her symptoms. Zara presented to her PCP complaining of difficulty sleeping, appetite changes, excessive fatigue, decreased libido, depressed mood, feeling of worthlessness, hopelessness, and helplessness, and frequent mood changes. The PCP told her she met the criteria of postpartum depression according to DSM-5, a manual used to diagnose mental disorders. Postpartum depression is a form of major depression that has its onset within 4 weeks after delivery. The diagnosis postpartum depression is based not only on the length of time between delivery and onset, but also on the severity of the depression. Untreated postpartum depression has dramatic effects on children's attachment and psychosocial functioning. PCP refers Zara to my office for psychotherapy. According to the PCP, Zara's cultural background contributed to her lack of awareness of her depressive symptoms. Zara does not perceive her feelings as a mental illness based on her cultural beliefs, but recognizes the need to seek help to discuss her problems as well as ways in which the problems can be dealt with. Identify 3 therapy modalities that can be used. One of the best ways to treat postpartum depression is through therapy. The symptoms of postpartum depression can be understood, worked through, and alleviated through psychotherapy. The first psychotherapeutic approach that I chose is motivational interview. Motivational interview is a therapeutic approach designed to help the individual resolve doubts and plan to change with a clear set principles and evidence-based technique that can be useful for increasing awareness and reducing barriers to treatment. Motivational interview is a client-centered counseling approach which expands the traditional pattern of motivation and focuses on readiness, willingness to reconcile the inconsistencies. Readiness will be influenced by Zara's priorities. Willingness will be increased by enhancing the discrepancies between what she wants and how her current behavior distracts her from that. The ability to change is rooted in Zara's confidence and readiness for treatment. Exploring her priorities, ambivalence, and confidence will reveal information about Zara's own desire and motivation to change. My first goal is to build trust and rapport with Zara, instill hope, and explore the barriers to change in hopes that she will move to consider a change through motivational interview. The change will begin to consider the effects of depression and options for psychotherapy. I chose this mode of therapy as a starting point to engage my client due to her cultural beliefs and denial of mental illness, and to move away from a state of indecision or uncertainty and towards finding motivation to making positive decisions and accomplishing established goals. Once she identifies the need for change, I will use interpersonal therapy, my second approach, to address sources of Zara's depression, personality and character problems viewed as being deep-rooted and having their origins in unconscious memory. A principle of interpersonal psychotherapy approach is based on the operating principle that psychiatric disorders occur within an interpersonal social context. The theory emphasizes the importance of the interpersonal environment and the relationship therein as the foundation of personality development. The focus of therapy is to instill positive expectation. Goals will be explained to patients to remove depression and to help resolve specific interpersonal problems. Ms. Zara will be encouraged to use family, friends, and community infant mothers group to reduce isolation and improve social support. Ms. Zara's depressive symptoms will be placed in an individually tailored interpersonal context. I chose this mode of therapy because it will address Zara's relationship with her significant others and include expectations which she had before childbirth for social support. The nature of her interactions and communications, satisfactory and unsatisfactory aspects of her relationship, and ways she would ideally like to change that relationship. Interpersonal therapy will help Zara understand associated life experiences within interpersonal dispute and role transition. My third approach would be to use cognitive behavioral therapy. CBT is one of, as is popularly known, is widely researched psychotherapeutic model with demonstrated effectiveness in the treatment of a wide range of emotional and behavioral problems. CBT is a treatment of choice for most patients who need internal resources and coping skills. Each session ends with homework, which is then reviewed at the beginning of the next session. The basic premise of CBT is that the depression is the result of cognitive distortions, and these distortions are learned errors in thinking. Clinical strategies are used to help the individual recognize the dysfunctional nature of their thinking patterns and to help the patient change that conclusion. It emphasizes the link between thoughts, feelings, and behavior. My intervention includes psychoeducation, cognitive restructuring, and relaxation exercises. Psychoeducation will be to advise Zara in managing mother-infant relationship. Cognitive restructuring will be challenging and modifying negative automatic thoughts and dysfunctional beliefs. Information processing correction. Behavior management will be increasing pleasant stimuli using pictures and structures, activities, stress management, and relaxation. An example of how the modalities support cultural diversity. The three modalities chosen was able to cultivate an awareness of my patient cultural beliefs in choosing a specific intervention for the patient. This was done by providing the patient with a therapist of similar ethnic background that will help patient feel understood and safe in discussing her personal beliefs without bias. Study shows 1/4 of African Americans and Latinos live below poverty level and develop postpartum depression. Studies have demonstrated success among this approach despite the cultural beliefs. So I will be introducing my patient Zara to this session of interview. So, but before I introduce Zara, I want to seek Zara's consent to record this interview. So, Zara, do you agree that these sessions be recorded?
Yes.
Okay. So, your doctor asked me to see you about your symptoms of postpartum depression.
I'm not sure. I feel ashamed to come here. I should enjoy my child. I have so much to take care of. My newborn infant, my sick parents-in-law, cooking, cleaning, nursing, my baby. I don't want people to think I can't handle it. But sometimes it gets too much. When I come from, a mother should be able to handle it on her own.
Are you aware of having a sense of harshness with yourself?
I guess so. I should be able to do it with a smile.
You find it stressful being at home with your parents-in-laws who both need help in caring for themselves.
Yes, caring for my parents-in-laws has taken its toll on me. It's particularly scary when there is no hope that either one of them is getting better despite my best efforts.
You sound dedicated to your family. Tell me more about what you feel.
When I first became pregnant, I was scared during the pregnancy. It was quite difficult for me because I was sick all the time and didn't have other family members here except my parent-in-laws. Then 2 months into my pregnancy, my parents, who were preparing to come to the U.S., died in an auto accident. I could not travel out to attend their funeral, which made it more painful. I was so emotionally, with severe crying spells, sleepless nights, poor appetite, anorexia, and irritable. Where I came from, a mom should be able to handle it on her own.
You feel responsible for everyone and everything.
Yes, asking for help means I'm weak in my culture.
I hear you saying that you feel overwhelmed, exhausted, and angry.
Yes, I do feel like I felt it as a mom. Sometimes I feel like I can't do it.
Tell me what made you think you are a failure as a mom.
My baby cries all the time. I'm not able to make breast milk, and my baby is not latching.
So you're saying that your core belief is that you have failed as a mom. You cannot do it as a mom.
Yes,
It seems like you feel the need to do everything yourself and reluctant to get help and feel guilty if you accept any. This lack of help, however, leads to a feeling of anger and resentment if you do not meet your expectation of caring for yourself or your infant.
yes.
How important is it for you to get away from the house sometimes?
Yes, I would like that.
Okay, with your permission, I will share some information that will be helpful for you in our next session. Okay, so welcome back to our next session, and this session will be using interpersonal therapy. And the goal is to identify the interpersonal problem areas most related to the episode that you related to me in our previous session. Do you have any conflict with your partner or extended family at this time?
Yes, I have no desire to be with my partner or his family. I feel resentment towards them now.
Do you feel you have adequate social support through your entire pregnancy up till now?
No, my partner is always away at work, and when he is home, he sleeps all day.
How do you feel about your role transition to motherhood?
No,
Yeah, how do you feel about your role transition to motherhood, Zara?
really difficult, overwhelmed, and anxious, feeling of inadequacy in caring for my newborn.
Now we have identified motherhood conflict, support conflict, and anger conflict. The homework today for you is to check in a few times a day at random times and write down what you are thinking. And now in our next session, we'll go over them using CBT. So welcome back again to our last session, Zara. Our final discussion is to use cognitive behavioral therapy to change Zara's cognitive distortions. Um, in our last session, uh, we'll, we shall be using session 5 of the COPE manual, dealing with your emotions in healthy ways through positive thinking and effective communication. What things have you learned in this program that is making you deal with your stress in a healthy way?
I have learned to stay positive.
If you look at the triangle of thinking, feeling, and behavior, you know how you think affects how you feel and also affects how you behave.
I believe I stay positive. I feel better.
Can you give me an example?
I think about my wedding, which is the happiest day of my life. I also think about my childhood experiences with my parents.
Does it make you feel good?
Oh yes, I also go from thinking negative to behaving positively.
Let's do some practice on mental imagery. Mental imagery is one of the ways to cope by imagining that you are in one of your most favorite places or doing what you love most. I want you to close your eyes and picture the following. Imagine that you are in a beach at Hawaii, the sunshine is glowing, the sound of the ocean wave is soothing, and you have a cup of cold iced tea or coconut water. Just think about it for a second. How do you feel?
It feels really good.
It was like, oh, were you thinking about anything else while you were doing the exercise?
Oh no.
That's very good. It shows you focus on the imagery. We will try one more exercise before we call it a day, and that will be on guided imagery. Before imagining or listening to this exercise, I want you to close your eyes and take 3 deep breaths. Breathe slowly through your nose and out through your mouth 3 times. Now picture a happy place and time in your life. It could be enjoying a special meal, celebrating your birthday, or visiting a special monument when you had no worries about your health. Now imagine it a really happy times. What were you doing then? Any pleasant smell? Did you feel the temperature? Now just enjoy your surrounding. Your body feels good. Fix these feelings in your mind. Just picture these happy times. So how do you feel?
I feel really great.
Can you share the time you remembered?
I remember celebrating my birthday, the same day my husband proposed to me.
How do you feel on that day?
So happy.
Okay, take 3 deep breaths again, and in each breath, say the word happy.
Happy.
Say the word one more time.
Happy.
And one more time.
Happy.
Imagine the word happy written in a warm sound. Now open your eyes and remain quiet for a few seconds before slowly returning to our activity. Good. When your mind is on something pleasant, there is no room for worry or sadness to come into your mind. Imagery takes practice like any other skill. By practicing it regularly, and you will learn how to be happy. Practice mental imagery. This will be part of our next session using the Cope manual. I want you to complete the assignment before the next session. And thank you for coming today. I started this therapy session with motivational interview, continued with interpersonal therapy, and completed the session with CBT. Thanks for watching.